Well, welcome once again to Calaveras Living. If you watch the program often, you've seen Dr. Randall Smart on our program 3 or 4 times recently, and he has brought us a marvelous guest today who's a board-certified cardiologist at Mark Twain Medical Center, and we're going to learn what's happening at the center to help people in the area. And I should tell you her name, Dr. Courtney Vergillia, and it's good to see you, Doctor.
Nice to see you. Thank you for having me.
Oh, our pleasure. Yeah, Dr. Smart, I thought he was going to be on with us, but he just kind of copped out.
Yes, surprise.
Well, he feels you know all that you need to know about your business.
Well, sure, but we're a good team. We're a good team that way.
Now, what is actually helping? What have you put together out there at the center?
Yes, so we are building a comprehensive cardiac center here in Calaveras County. And so we've been working diligently at that. So we'll be able to offer a full scope of cardiac consultations. So what does that mean? That means if you have chest pain or palpitations, or you've had a blockage or a stent or bypass surgery or a valve problem, a rhythm problem. So again, I'll be seeing patients and able to handle any myriad of cardiac issues. We'll also be able to offer a full diagnostic spectrum. What does that mean? So if you need an ultrasound of your heart or an echocardiogram, if you need a vascular study done to look at carotid arteries for blockages, or do I have an aneurysm in my belly, we offer all types of stress testing as well. And I'll be implementing new types of stress testing that didn't exist here before. So bringing that to this area as well. And also Holter and event monitors. What are those? So those are things that you can wear underneath your clothes, kind of like our little microphones, that nobody has to know you have on, and can tell about what's going on with your rhythm, is there a problem, etc. So it will be a very comprehensive, non-invasive cardiovascular program.
Well, that's really good to hear. That's good news for this area.
It is. It's
now,
exciting.
When you say, just for my interest, stress tests, I'm so used to taking a regular one, and we all are. What type of new stress tests are there?
Yes. So there are, and I say new, but new to this area. It's not that it's a new type of stress testing in medicine. So currently they do treadmill stress tests, and then there's a type called nuclear stress tests, where you get images under a camera with a medicine injected that is called a radioisotope. So it's a medicine that's taken up by the heart, so that shows the imaging of the heart and the blood flow of the heart. And then you exercise on the treadmill if you can. If you can't exercise on the treadmill, because not everyone is able to, back pain, knee pain, hip issues, there are ways to stress the heart without you having to physically do that stress. And so currently they offer one type of medicated stress test. I'm going to introduce another, which is, again, mainstream cardiology, but hasn't existed in a lot of Northern California from what I've found, so that we can take care of any type of patient. And then you go back for your second set of images, and then I compare them, and based on how the blood flow to the heart looks will help tell if you could have an underlying blockage or heart issue. So it'll actually be 6 different types of stress testing that we'll offer. So we'll be able, not that one patient needs all 6 types, but we'll be able to offer to any type of patient that would need a stress test.
Okay, now how did this all come to pass? They hired you and you put this all together, or they started putting it together and then hired you, or what happened?
No, they were recruiting for a cardiologist, and it was just a unique opportunity to build a program. So I was medical director of non-invasive cardiology in Chicago, and had done a lot to improve the program there. We were nationally accredited in echo, which I was very proud of. And so again, just came across this opportunity, and they said, well, we want to build a heart center. What do you think? And I said, well, this is what I would want to do, because again, these are the things I need to accurately and do the job that I want to do to take care of patients. And so some programs have just a piece of this, or they just see cardiac consultation, and for all the testing you got to go to this center or this hospital. And I said, no, we're going to do it all under one roof. And so they said, great, that's what we want. And so it's really been a great collaboration, though, to get everything going, because it's one thing to have the vision and the leadership in the cardiology realm, which I provide, but it's another to have, institutional challenges, which the administration fully supports and helps me surmount, to get all these things accomplished for the community.
Now, did Mr. Marks, did he contact you or someone else, or did you apply, or how did that happen?
So actually, my husband actually found this opportunity online. They were posting, and he says, oh my gosh, Calaveras, look at this. And he looked it up, and he says, grapes and lakes, this is awesome. We have to check this out. And I said, what? We're not leaving Chicago. I mean, it was never our vision that we would ever move away. So
Sure, anybody who lives in Chicago would love to live there during the winter.
I know. The winter is no doubt the sour spot of that. But I mean, just amazing things to do, amazing food, great people, and that's where we were born and raised, so that was
Sure.
home. But no, I mean, by far we have enjoyed this winter compared to the negative 30 below with wind chill.
Well, this has been a very mild winter.
Oh, this
for
has been
here.
fantastic.
Yeah,
I know
no.
we'll pay for it this summer, but it's been fantastic.
Were there a lot of applicants? I mean, were you selected from a big pool, or they kind of zeroed
I
in
don't
on
know.
you?
I know there were at least one or two others. But what I would say is I never expected to leave Chicago, and it was the opportunity in large part because of Craig and the other administrative members of that team, Sean Anderson, Dr. Griffin, that I met, that made it seem possible. Because it's one thing to have good ideas, but you have to be able to execute them. And so
Oh, it costs money.
Indeed, it costs money, and it's not even, yes, money is part of it, but it's changing the way people think. And so a system that has said, well, I've done it this way, why do I have to change? Well, sometimes, maybe just the way you've done it all the time isn't the best way to keep doing it. So they've been very supportive, and again, it's truly been an excellent team collaboration to get this thing up and moving.
Good. And how long have you been here now?
We moved here in August.
In August, so September, October, November, December, what, 6 months or so?
Yeah,
6
8
or
months.
7?
Yeah,
6 or 8.
yeah.
Okay. And how did you go about, who helps you in this? How did you go about assembling a staff to help you?
So, I mean, that's part of, this collaboration and this teamwork that we've had. And so I have an excellent business director, Debbie Peterson, who has helped, recruit, helps me interview, and we decide, well, who's the right member. And I think that, again, our center is going to be awesome. It will be phenomenal and incredibly unique from what I've seen in Northern California, all under one roof, let alone in a smaller hospital, right? So I've been to other hospitals in Northern California in the bigger centers, and they don't do everything we're going to do under one roof, which is different than how it is in the Midwest. Practice in the Midwest, it usually is under one roof. So to me, this isn't unique, but what you see around the surrounding areas is that we really will be quite unique. And so although that is all the pieces coming together that I'm excited for, I think the thing I'm most proud of is my staff. So we've recruited some excellent members so far. So Jody Brixey, Debbie Mayer, we've recruited a Echo Tech, Len Pollock, Maria Hankins is my nurse who will be in clinic with me. So again, those are the things I'm most proud of, is the
How
team
do you
we've
find
assembled.
them?
Fortunate. They've applied, and they've all come from outside the institution. So I think they come, they see. They talk with me, we talk about the vision, they see the center that the hospital's put together for us, and they want to be a part of it.
Okay, when you say under one roof, is it going to be a separate building or part of the hospital?
It's a build out from the hospital, so it's attached to the hospital, but it's our own heart center.
The building is already there?
Yes, it was a remodel of what was physical therapy. It became ours, and we changed, and I, again, was participated in the design of the center, so it's really been a good
really
collaboration. Yes.
Yeah. Lots of new equipment then?
Brand new, yes.
Yeah.
So brand new steps, which are sort of elliptical treadmill in-betweens. We have brand new treadmills. We have a brand new stress lab, brand new stress system. So yes, it's state of the art.
Okay, well, as you know, around here, many people have to drive, as they say, down to the valley or to San Francisco or wherever to get some of their heart problems taken care of. So once again, tell us all the services you'll be providing.
Yes. So I'm board certified. I'll tell you about my background and tell you what we're going to do along those lines.
Where did you take your training, by the way?
So medical school, so undergrad at Northwestern in Chicago, medical school at Loyola, and then I did my residency and fellowship at Washington University, Barnes Jewish Hospital in St. Louis, Missouri.
And you're only 12 years old.
I'm only 12. It's like Doogie Howser et. So
you must have the right genes.
Right. I'll take it.
Okay.
So, and then I was in a practice for 5 years in Chicago, and as I said, we never envisioned leaving, but it was just such a unique opportunity.
So, and you were the head of that when you left?
I was the medical director of non-invasive cardiology there, and got our echo lab nationally accredited. Was very involved in teaching. I taught the residents. I gave, symposiums, talks for EMS. That's one of my passions, is taking care of the EMS folks. So I have several firefighters in the family. And so I started a program in Chicago to help give them education about how to recognize a heart attack. And they're our first line, and it really should be a continuum of how we care for that patient. And they're the first ones to touch that patient. So you got to give them the education up front and make sure they know how to communicate with you so that you can line up on the hospital side. So when that patient gets there, they get the best possible outcome. So that's something I'll institute here as well. So we moved here for this opportunity. So I'm board certified in internal medicine, cardiology, echocardiography, so that ultrasound of the heart, nuclear cardiology, so for the nuclear stress testing, and I'm certified in vascular as well. And so we'll offer all of those things. So I won't do internal medicine, so that's where I'll rely on Dr. Smart for his expertise.
Okay.
I will specify into cardiology, but the full cardiac consultation, we'll be doing echo, vascular studies, which means looking at the arteries or veins, all types of stress testing, Holter and event monitoring, which again has to do with rhythm issues or symptoms. If you were having palpitations, to say what it is, or if I feel dizzy, is it a heart rhythm issue? So those will be our services.
Well, you hear so much, especially on television lately, ads about women and heart problems. So they seem to have different symptoms than men, right?
Well said. You've been listening.
Well,
good job. So
it's just that you don't want your wife to have problems.
this is true. You don't want anybody to have a problem. So heart disease is the #1 killer of men and women.
What are some of the first feelings that women get who might be having a heart problem?
So the classic, but not everybody's body reads the textbook, is that, oh my gosh, an elephant standing on my chest, right? You look sweaty, you can't breathe, and maybe a little ashen. So that's the classic. But as I said, not everybody's body reads the textbook.
That's what men have a lot.
Well, it's more common in men. This is true. So the people whose body are less likely to have read the textbook are women. And so some of those, what we call atypical symptoms that you need to be aware of, or it might just be, gosh, I just feel nauseous, or I'm just getting out of breath with activity when I used to be able to do X. Or maybe they're just diaphoretic or sweaty. So those are some of the different symptoms that women may present with, or it could just be arm pain, right, or heaviness. It doesn't always have to be that elephant on my chest.
Arm pain in either arm?
It's more common the left arm, but there are people who've had heart attacks, and it's usually the right arm for them. So that's when, again, you say, if you're somebody who presents with a different symptom than usual, that elephant on my chest, that's when I tell the patient, and you say, look, this is what you call your angina, or heart-related pain. So if you get this symptom again, this is your warning sign to get help. You don't blow it off and say, oh, it's just indigestion, or oh, it's just my tennis arm or something. This is what we call your anginal equivalent, or sign for trouble for your heart.
So when somebody comes in and has, some symptom, where do you start?
Take the history. So I'm a big believer, you got to talk to the patient. And a stress test is good, an echo is good, vascular study, but to me, I'm not treating a test. You have to treat the patient sitting in front of you. And it's my job as that cardiologist to help put all those pieces together to say, look, this is what I think is going on. But the first thing is not just a bunch of tests. The first thing is talking to the patient and saying, gosh, what do I think is going on? Tell me what your symptoms are. And taking a good history. And then listening to the patient with my stethoscope. You need to examine them, and you can pick up a lot of things. And then, if needed, other tests, whether it's labs, or whether it's an EKG, or whether it's some of the other diagnostic things that I've mentioned we'll do in the Heart Center. But it's always putting it all back together, how it relates to you as the patient.
So if people come to the medical center out there, they get to see you, right?
If they sign up to see me in clinic, yes, absolutely.
Okay.
Yes.
They don't go to someone else first.
No, it's me.
Okay. Well, that's good. And is everything up and functioning now? Have you had a number of patients already?
So we're phasing it in. So we've started cardiac rehab in February. And so cardiac rehab services, I actually didn't even mention, is something else as part of our continuum here that we'll provide.
Okay.
Cardiac rehab is a program that is instrumental in keeping people out of trouble. And so cardiac rehab is big in prevention, and I am huge in prevention. An ounce of prevention is worth its weight in gold. If you can get ahead of a problem before it catches you with your tail in the door, you're ahead of the game. So cardiac rehab is a program of supervised exercise where I have trained nurses who are monitoring your heart rate, your heart rhythm. They're watching your EKG and the telemetry. So this is people who have had heart attacks, stents, bypass surgery, valve surgeries, certain types of heart failure qualify. As a doctor, there are a lot of other patients who would actually benefit from it, but unfortunately at this point, those are the only insurance covered indications, so those are the only patients we typically see because most people don't want to pay out of pocket for that. It could be expensive if their insurance weren't involved.
What things aren't covered?
What's that?
What things aren't covered?
Well, like peripheral arterial disease.
Pardon?
Peripheral arterial disease, so blockages in the arteries, for example, or somebody with a certain type of cardiomyopathy or weak heart. We know exercise conditioning can be good for those people, but currently there are no indications for the peripheral artery disease, although we know medically they would benefit. And the cardiomyopathy is not broadly covered. They've now at least started to cover certain types of heart failure, so you have to qualify under certain guidelines. But that's exciting, at least the indications are broadening. And so, as I mentioned, it's supervised exercise and then a ton of education. So my nurses are giving the education about, well, what are these medicines for? How do I prevent more blockages? Stopping smoking, diet, exercise. It's common also to have a little bit of depression after you've had a significant heart event.
Sure.
And it's important that patients know that's normal and it's okay, there's nothing wrong with you. And so we have a social worker involved who comes and gives us stress education. We have dietitian involved to come give healthy diet tips. And so that is another big piece in the Heart Center. So cardiac rehab, and then obviously the diagnostics as well.
Now, is there a place in the building there for regular exercise programs, or people will do that independently on their own?
So there is something called Phase 3 cardiac rehab, which is after you've graduated from the Phase 2 program. The Phase 2 is 12 weeks. 3 days a week for 12 weeks. Once you've graduated from that, you're eligible for Phase 3, where it's a nominal fee to come exercise at our equipment instead of going to a gym. So that way, if God forbid something happened, right, you've got trained nurses and a cardiologist right nearby. But you have to have been in the program to qualify for that. So we don't have kind of an open gym membership. But if you've been a cardiac patient in the program, you would qualify to participate in Phase 3.
Yeah, luckily around here there are certain rehab places where they can go and work out on their own. Okay.
Yes.
What are we missing so far? Anything that we haven't talked about that you offer?
I think that's fairly inclusive. Yes.
Well,
so
it's quite a
several
bit.
pieces. It is. It is, and it's no small task to put it all together. So.
What enthusiasm do you find around the rest of the hospital for this coming in as an addition to the other services there?
Oh gosh, I think everyone is very excited. We hosted the chamber mixer about end of February, and I mean, I guess they normally have, maybe 30 or 40 guests. We had over 120, so I think not only people within the hospital, but within the community are excited to not have to travel to the valley, to not have to go to a bigger city for their cardiac care, and the depth of services we will provide will allow that. So it's exciting. It's exciting to help build that.
Of the patients you've had so far, what age groups normally have been there so far?
So far, as you had asked that question, is what's active so far. So I was mentioning we're rolling out, so we've already done cardiac rehab. We started stress testing this week. The hope is by April we'll have our full complement of services going. And so as far as age range at this point, with stress testing and cardiac rehab, it's typically a middle-aged to older population. But in clinic, I mean, again, I'm an adult cardiologist, so I see patients 18 and above. I have 18-year-olds who have heart issues, whether it's congenital issues like holes in the heart or certain types of heart abnormalities, heart failure. I've had people young enough, unfortunately, in their 20s, even having heart attacks, whether that was drug-related or related to diabetes, etc. So I see all age ranges from 18 on up.
When you say something could be drug-related, if a person has a heart attack that is drug-related, is that usually more serious or more, say, deleterious than someone who has just a so-called regular heart attack?
Yeah, I don't think any heart attack is is a good one, right? No. So I would say it just adds a different level of complexity that as the cardiologist caring for them, you need to know about, because there are certain medications that can cause harm if you don't know that there are certain drugs on board, and so we're always careful to ask. So is there any chance? Then you run a urine drug screen if needed, etc. So it just changes the way you take care of that patient, again, individualizing that care.
Okay. Now, do you yourself personally have to consult with anyone, or you make the decisions?
No, I make the decisions. I'm a cardiologist.
Okay. I mean, you don't feel you have to call somebody or get a second opinion or anything?
Oh gosh, so to that point, I always think, again, there are going to be services here that we don't provide. We don't do open heart surgery. We don't do cardiac catheterizations. So if you're actually having a heart attack, you don't stay at Mark Twain Medical Center because we don't have a cath lab at this point. So I've made connections. I had all of my network in Chicago. So if somebody needed a heart transplant or a ventricular assist device, these are all, again, other things that we can offer in cardiology. We didn't do them at my hospital in Chicago either. So I had my network of referring physicians who I would send them to if they needed a higher level than we were able to provide. And that's what I've started to create here in California as well.
You're getting some names around here.
Absolutely.
Or people you know.
Yes. So who, again, we are going to be a very comprehensive center, but there are some things we're not going to do, like open heart surgery or an angiogram. So if you needed those, or putting in a defibrillator, I've made those connections so that, again, with cardiologists and surgeons that I have gotten to know and trust, take excellent care of my patients.
Well, it certainly seems like this will keep you busy.
It will, indeed. But that's the way I like it. I love what I do.
And it's very crucial because of the type of malady, type of problem you're dealing with in people. I know I went to the emergency room at Mark Twain not long ago having chest pains in here, and I thought, I've never had a heart attack, but I said, I think this is a heart attack. But I had pneumonia.
You did the right thing.
I had pneumonia. But it's amazing how misleading that can be. You just think, well, maybe I guess some people think the worst, some people
better safe than sorry. You don't want to flirt with that, right?
But it's interesting that Dr. Perry, have you met him out there?
I've not yet.
Oh, he's a very good emergency room doctor.
Good.
But
Dr. Petty, right?
Petty,
Yes,
that's right.
Yes,
that's
I was
right.
like, a Dr. Perry, I don't know. Dr.
No,
Petty,
Dr.
yes,
Petty.
he's great.
Good sense of humor.
Yes, he's great.
And after a while, he said, no, you just have pneumonia. And then he says it's there and it's obvious. So that took a number of weeks to get over. But he treated me very well.
Good.
And
I'm glad.
I think...
Yes, but you did the right thing. If you're not sure, you need to get a higher level of care. You don't want to be at home, and time is heart muscle. And so when people say, I've had chest pain, well, your chest, there's a lot of things in your chest that can cause pain, whether it's the muscles, the bones, the esophagus or the food tube, your lungs, which was your case, but God forbid it's a heart or a blockage issue. Yeah. And if you don't get you don't get help, you can get into more trouble.
You didn't mention the fat.
Well, it shouldn't cause pain. It may cause the underlying heart issue, right?
Okay. Now, have you settled in here pretty well?
We have.
Yeah,
we're enjoying it.
Close to the hospital?
We are renting in Murphy's.
Okay.
So we've been very happy so far.
Oh, that's good.
Yeah.
It's difficult here to find a home. There are very few homes for sale. My wife and I were finding that I had heard there are only 29 houses in all price ranges in Murphy's.
Is that right?
For sale right now.
Interesting.
But if you can get a little farther out or maybe a little closer to the hospital, that's good.
Yeah.
Now, are you going to be there 5 days a week or?
4 days a week right now, and so cardiac rehab will be there Monday, Wednesday, Friday.
Monday, Wednesday, Friday.
Yep.
Okay. Now, is there anything we haven't covered? Because I'm just kind of
having
fun.
You're doing great. No, I think you're doing great.
Hey, what am I here for?
You've got it all covered.
But you have a lot of information, and you give it very quickly and very succinctly too. But is there anything? I guess we haven't given the phone number yet, have we?
I don't know that we have. Yes.
We could get the people in the control room to pop that up. There it is, 209-754-6200.
Yes.
And they can call you. And how many people actually in the whole unit there?
So we've got 2 front staff. Mm-hmm. We have, as I mentioned, right now 3 nurses, recruiting for a 4th, and then my echovascular tech. So
maybe 7 besides yourself?
Yeah.
Mm-hmm. Oh, that's good.
It is.
Now, are they mostly young people or older people who have worked in cardiac places before?
Well, they are actually mostly what I would call young.
Uh-huh.
So I'm not, biased one way or the other, but I'm pretty excited that they, are full of energy, and my hope is it's the 30-year plan for all of us. So.
Yeah. Do people sometimes meet you and think, how could you have all that experience that you have because you look so young?
If I had a penny every time I heard that, boy, I'd be doing a medical mission trip somewhere. Yep.
Well,
yep, I hear it daily.
Does it run in the family?
That I don't know. I don't think so. I think and probably not. My sister doesn't get accused quite as much of that.
Oh, okay, but it must be somebody say, they say, gee, how can you have all that?
Yes, all at the age of 12.
Experience and have the responsibility that you have.
Yes.
But that's good.
I love what I do.
But you sure we haven't missed anything?
I don't think so, John. I think you're spot on.
No, I'm not spot on. You're spot on.
Oh, I think it's
a
team
Dr. Smart
effort
for
here.
bringing you.
I do too.
It's seldom that we do the half hour and we've learned everything that we could learn, but there must be something we haven't
Well, I
learned.
think there's always something to talk about, but I think we've done a great overview. I can try to think.
I'll take your word for it.
Yep. Yep. I would say it's been very inclusive. We're just excited. We're excited to provide the service. We're excited to get everything up and running. So it's been a great adventure.
Yeah, as you know, a lot of innovative things have been happening at the Mark Twain Medical Center with the robots and the telehealth and various things that
Which Dr. Smart has helped
working on
spearhead.
too.
Yes, absolutely.
Yes, so I think they're making great progress.
They are, yeah. We implemented a new EKG system. I don't want to bore you with the technical details. I mean, I'm thinking, so the hospital updated all of the EKG machines, and we now they are stored from the EKG machine wirelessly, and so that I can read them wherever I am. So that again has improved service in the hospital for availability and accuracy and timeliness of EKG reads because they're immediately available as soon as they're done. So.
That's really good.
A lot, as you say, a lot of innovation and things going on. We're implementing a new diagnostic system as well as part of all of this cardiac imaging that we'll do. It will all be archived in a system. So there's been a lot of technological advances as well.
Yeah, in the years that my wife and I have been here, which is a little over 9 years, we've seen much progress, shall we say, at Mark Twain.
Yes.
And nice people.
Yes.
And
I wouldn't be here if it weren't for the great team that I saw.
Yeah.
We'd be capable together of building something great.
Well, they even listen to complaints. I went to a doctor or Mr. Marks one time, and I said, I have certain complaints because I know something about customer service. He says, come on in.
Yep.
We talked for more than an hour. And he said, that's right on.
Yeah.
We'll work on that. And he did.
Yeah.
So,
He's very motivated.
but it's good you're here.
Happy to be here.
Well, good luck.
Thank you. I appreciate it.
Keep all those people healthy.
That's the plan. Prevention.
Oh,
Prevention.
I should be exercising right now.
Jog a little bit in place.
That's right. So if you don't forget the number there, 754-6200, and Courtney Vergillia is there to help you with a staff of many other people who are hopefully have the same good attitude she has. So we'll see you next time on Calaveras Living.